Hello, everyone. We'll be starting in 5 minutes, so please make sure that your mic is off throughout the session, yeah? Greetings and welcome back to the QIU Public Health Campaign 2022. I'm Kalai and I'm joined by my MC partner, Shivena.
Hi everyone, welcome back. It's good to see some familiar faces here again joining our session. We are excited to have with us Dr. Doris George, a renowned chief pharmacist and cardiology pharmacist in the Hospital Rajakumarisri Bainer.
Cardiology pharmacists are highly approachable medical professionals who thanks to their expertise in drug therapy and computerized medication records, are ideally situated to give patients the medication instructions they need to improve safe medication use. They also work closely with primary care physicians to support the prevention of cardiovascular diseases. Our renowned guest today, Dr. Doris, will be enlightening us about the heart health in the hands of cardiology pharmacists.
Don't forget that we'll have our usual quiz session after the talk. If you place among the top two scorers, you can win prizes. Thank you, Kalai. And now, Dr. Doris, the floor is yours.
Thank you, MCs, for your wonderful introduction. Can you all hear me clearly? Can I know if I'm clearly the MCs?
Yes.
Thank you. Okay, so I'm going to talk about heart health in the hands of pharmacy. Okay, I have removed the cardiology pharmacy because I think the heart health can also be in general pharmacy. So I'm going to talk about how we can the pharmacists can help in the heart health. Okay, in both the community and also the hospital setting. So as you all know, the cardiovascular disease, based on the WHO website recently, it is estimated that 17.9 million people die from the cardiovascular disease in 2019. So this represents 32% of all global deaths, okay? And out of these deaths, 85% were due to the heart attack and stroke, okay? So as you know, the cost of healthcare is rising, and this increasing of this cost of health are driving individuals to take responsibility for their self-care, including self-medication. So incidence of self-medication at the community pharmacies is also high in Asia, not only just the Western country. So in Asia, it's as high as 80% among the Thailand community and 30% among the Malaysians. So it's relatively high if you can see people taking care of their own self and self-medicating. So pharmacists, as you know, are knowledgeable healthcare professionals. They actually possess 4 years of undergraduate training and 1 year of pre-registration competency-based training in whether hospital setting or community center or also in the private. So pharmacists are expected to undergo continual professional development for annual renewal of practicing certificate. So even though they are in either the health or the private or the government setting, they actually need to renew their practicing certificate by continual professional education. So if you see adult in Malaysia visits the community pharmacy on an average of 31 times a year, okay? And in other countries such as Australia, the United States and the United Kingdom, visits to the community pharmacy on average is around 16 to 35 times a year. So this, if you can see the rate, it is actually similar or similarly high compared to the Western countries. This only proves that Malaysians are also seeking self-care treatment in the community pharmacy. So pharmacies are healthcare settings that encounter healthy and ill patients seeking prescription medications, OTC medications, and other commercial goods in the pharmacy. So this creates an environment for healthcare promotion, advice, as well as education for patients who come and seek help or seek any kind of advice at the pharmacy. So in the past, this advice was limited to how best to take medication. So in pharmacies, we used to just advise them, take this medication 3 times a day, at morning or at evening, okay, stuff like that. But now increasingly, community pharmacy workers are carrying out other activities such as giving advices on healthy lifestyle and management of long-term medications. Sorry for the typo. Yeah, so involved in many other things other than just giving advices on medication. So the role of pharmacists has evolved tremendously over the period of time. So how can pharmacists contribute to cardiovascular risk in identification? So one of the role that pharmacists can do is identifying risk in cardiovascular. So pharmacists play an important role in screening and monitoring risk factors for cardiovascular heart disease in the community. So I'm going to go step by step and tell you how they have done it internationally and also locally, how pharmacists have played a great role in screening patients. So if you see, this is a study done around 942 youths in Malaysia, aged 15 to 24 years old, and they were screened, and it was found that at least youths in Malaysia with at least one cardiovascular risk factors were around 70%. Okay, so what are the cardiovascular risk factors that they were studying, which involves obesity, dyslipidemia, hypertension, smoking, and also family history of cardiovascular disease or premature death due to cardiovascular disease. So if you can see, quite high, and the age group is quite young, which is 15 to 24 years old. Okay, this is what the study has been conducted. So if you see the elderly in Malaysia, the prevalence, they have done this study in among more than 3,000 Malaysians aged more than 60 years or older, and they were screened in 2015. They found that the prevalence of hypertension was 70%, and third of them had diabetes, which is around 37%, and 2/3 as dyslipidemia, which is around 65%. Okay, so we can see that patients in Malaysia, either elderly or the young, they have at least one risk factors. You can actually screen them and find that at least they have one risk factors easily. So cardiovascular heart disease, they have 2 types of risk factors. One is called non-modifiable risk factors, and the other one is a modifier risk factors. So non-modifiable risk factors are increasing age. So as you age, your risk of getting cardiovascular disease is higher. And another thing is gender. Male seem to have higher risk compared to the female counterpart in developing cardiovascular heart disease. Hereditary is if you have family history, if your family if you come from a family who have cardiovascular heart disease, then the chances of you developing cardiovascular disease is high. So these are non-modifiable risk factors which we cannot do anything, but it is something that we have to live and manage it. But there's modifiable risk factors, which is hypertension. Okay, high blood pressure, it can be controlled. High lipid LDL, which is a low density lipoprotein. Inactive lifestyle, obese, which BMI very high, diabetes, smoking, and alcohol. These are all modifier risk factors, which if you do develop, you can either control them, or if you're not having it, you can prevent them from occurring in your lifestyle. Okay. So just to re-emphasize to you again, the modifier risk factors are alcohol, high blood pressure with hypertension, diabetes, sedentary lifestyle, high cholesterol, and smoking. So we're going to see how pharmacists in the community will be able to identify these risk factors and or help screen patients in the community or individuals who come to their pharmacy to get early detection for them. Okay, and see whether does it has an impact in their lifestyle or in the life of those people who comes. So first we're going to see a screening for cardiovascular risk factors, like I was explaining to you. So So first we're going to go to lipid, okay? And you can ask me why I'm putting lipid first. So I'll try to tell you why it's very important, lipid and cardiovascular disease, okay? So if you see, this is a study it is a study that was done in 2020, a meta-analysis that evaluated the outcome of 11,750 patients, statin-treated patients, and 9,700 patients treated with non-statin for primary or secondary preventions trial. Okay, primary prevention means you don't have the heart disease, but you try to use statin. Statin is the drug that you use to lower your bad cholesterol, which is LDL. Okay, and secondary prevention is you already have cardiovascular disease, so you want to prevent another attack. So that's called secondary prevention. So they have summarized all those trials together and did a meta-analysis to see whether there is a benefit in lowering the cholesterol level. So this is the chart that they came up with. So from what this is, some of you may not be able to, this is called a forest plot. Okay, so this shows that whether you are older or whether you are younger, whether you are treated with statin or you're not treated with statin, lowering your cholesterol have a benefit, which is every 1 millimole of reduction in your LDL cholesterol in the elderly, which is more than 75 years old, the major vascular event, which is cardiovascular death, okay, any death which is caused by cardiovascular, acute coronary syndrome, that means a heart attack, okay, coronary revascularization, that means you have to go for a PCI, angiogram, or CABG, or stroke reduces by 26%. So if you can just reduce 1 millimole of your cholesterol level, you can actually reduce your major cardiovascular event by 26%. So this is a recent study that they have done in the elderly especially. So if you see the elderly, the risk is 26%. If it's in the young, actually it is around 15%. 15% reduction. That's not to say there's no reduction, but a bit lesser than the elderly. Okay, this is another trial which was done in 2015 or so. They did all the major trials, and they have done all the kind of types of drugs that the patients take for reducing their cholesterol level. And of course, the 5 major therapies, which is the fibrate, the azithromycin, okay, the statin, and the niacin, bile acid sequestrant, and PCSK9 inhibitors, which is the latest drug to reduce cholesterol level. They found that with this therapy, 1 millimole of reduction in lipid LDL cholesterol reduces major vascular event by 23%. So the numbers did not change from the previous study and the recent study. So if you can see, so reducing your cholesterol level really reduce your risk of major vascular events, okay, by 23%. So the more you reduce, the better it is. So because of that, the European Society of Cardiology, they have come up with a target for LDL cholesterol, okay, for cardiovascular risk. So they found out that if you have a low risk, so you do not have any risk at all, your cholesterol level will actually be just less than 3 millimoles per liter, okay? You just need that kind of target. But if your cholesterol risk is moderate, that means you are a young person and you have diabetes, or you have a long duration of diabetes without any other risk factors, so your target cholesterol level should be less than 2.6 millimole per liter. Okay, but if your cardiovascular risk is high, so you have a very high cholesterol level, which is a total cholesterol of more than 8, okay, or you have a family history, or you have a kidney disease, or you have diabetes with other problems, more than 10 years of diabetes. So what they suggest is you reduce the cholesterol level to be less than 1.8 millimole per deciliter. And if you are considered very high risk, if you already have a cardiovascular risk, or you have a cardiovascular event, either clinically or imaging. Now you can actually image and see how your cardiovascular your coronary artery is. Or you have a family history, or you have severe renal impairment, or you have diabetes with target organ damage. So you're considered very high. And so they actually said that you should reduce your cholesterol level less than 1.4. That's really, really low. Okay, so we have to reduce your LDL level to less than 1.4. Okay, so this is how you decide how low your patient's goal should be. Okay, so they also have patients who have for secondary prevention with high risk. You can at least reduce by 50% or less than 1.4. Okay, this is for patients with primary or very high risk, or for secondary intervention or primary prevention with very high risk. Okay, this is what we have already talked about just now. So you need reduce to less than 1.4. And interestingly, they have these patients who have a cardiovascular event and who experience a second event. That means they have a heart attack, or they have chest pain and got admitted to the hospital, and then they have a second cardiovascular event within the 2 years, or stroke within the 2 years. Okay, so and yet they're taking the maximum tolerated statin therapy. The cholesterol level, the LDL level, should be less than 1. So they can think they think it's a class 2B evidence. Okay, it's not a class 1 evidence, but it's class 2B. They said you can even go as low as less than 1 millimole per liter. Okay, so this is how the target goal for LDL cholesterol by the latest ESC guidelines. So, pharmacists, how do pharmacists play a role in all of these things? So, lipid is very connected, associated with cardiovascular problems. So what you can do, you actually, pharmacists have done in Sweden, this is a Norwegian population where they have actually patients who have never been on medication before. They screened among patients whose age is around 54 years old, average. They have found out that 11% of them are unaware of their high cholesterol. And we are talking about total cholesterol of more than 7. So that is very high percentage, okay? So when we do, usually what pharmacists can do in their clinic is, we call this POC, or point of care. So you just have you just need to prick their needles, take their blood and run it with your machine. You can actually get their total cholesterol or LDL, whichever the machine can produce, okay? So this can have been done in countries in other places. Okay, and also community pharmacies in this thing, they're conducted about 4,000 POC, which is point of care, just now the needle prick thing, screening at the University of Minnesota, and 6.2% of the patients reading were more than 4, LDL cholesterol were more than 4 millimole per liter. So you see, you can actually, they actually manage to screen patients like this. This is a community pharmacist doing it in a university, okay? So pharmacists also have pharmacists at the community pharmacy and non-healthcare setting also have screened 888 individuals and found that 80% of the participants have abnormal results and were referred to their healthcare providers. So 15% of them receive at least one new diagnosis, which is including dyslipidemia. So this 15% is all the patients that were referred by the pharmacist to the GP, and they found out that at least 15% of them were at least actually diagnosed of having one new diagnosis, like maybe hypertension or dyslipidemia. Okay. Okay, so does this intervention really help? Okay, what, like all these things that the community pharmacists do, does that really help? Yes, actually it really does. So intervention delivered by the pharmacist, as in addition to the usual care is the patient just go on the normal things, but if you actually intervene by the pharmacist, they show that there's a significant reduction in the LDL, okay? They at least a 0.28 millimole compared to the normal group. Also, it is significantly improved overall adherence to lipid. Adherence means complying to taking the medication daily, okay? So if the pharmacist intervene, they can actually improve the LDL level as well as adherence of the patient to their lipid drugs. So this is some of the intervention. If you see all the intervention, they can actually reduce the LDL, total cholesterol, and TG. This is all significantly reduced with a pharmacist intervention, whereas the HDL does not have very significant, okay? HDL will usually reduce if you do a lot of exercise, that it will usually increase by time, okay? So pharmacies, whether they are community pharmacies or whether they're clinical pharmacies in the hospital, they can actually have an effect on reducing the total cholesterol or the LDL cholesterol, okay? So what are the interventions done? So some of the interventions done that they do that make them have the effects just now that you saw is they actually follow up the patient. So once they know that the patient is on this high cholesterol, they follow up, they actually refer them to the doctors, and then they will follow up them, ask them to come back and check this sugar, lipid over the course of time, maybe 1 month or 2 months later. They actually educate them about the importance of the lipid lowering. They counsel on their medication, and they also have phone call reminders. These are some of the small things that I did. Actually, there's more other things that the pharmacists will do to make sure the patients are compliant, and also to see how they can improve their patient's outcome. Okay, besides that's all for lipid. That's a lot of things that we have learned about lipids, and we know how important lipid is with heart disease. Okay, so glucose is another, glucose or diabetes is one of the major risk factors, especially in Malaysia, for contributing to heart disease. Okay, so if you see, pharmacies have successfully screened and identified, just like lipid, they also have identified patients of high risk of cardiovascular disease or type 2 diabetes who do not have any follow-up appointment with doctors. So they realized that once they have screened, they can uptake of referral to the GP range from 13 to 92%. So when they actually screen these patients for glucose and they found that the glucose level is high, they actually referred to the GP, general practitioners, or doctors, and they found out that 13 to 92% of them actually went to the GPs, and they were treated for their conditions. Okay, so pharmacists can play a role in screening this group of patients, high-risk patients, for CVD or type 2 diabetes. Okay, this is a study for involving 6 studies, total of 10,000 over referrals done by pharmacists. Of course, the most challenging things that the pharmacists will feel will be the cost of implementation. Okay, the point of care monitoring at the community pharmacies can be costly because they need to buy the machine, they need to buy the strips, and the strip have expiry dates. So they need to have patience to make sure that they use the strip. Okay, costs including labor, marketing. They have to make sure they need to do marketing. They must tell them that this kind of service is available in the pharmacy. Okay, they need to have banners, they need to have equipments, and they also need reference materials. So you need to educate the patient, you need to have reference medicine for the pharmacies, and also reference material for the patients. But they said, okay, in the study, they also said that the cost will decrease over time. So as, of course, the beginning, you have to buy all those things, you need to do your promotion and marketing, but over time, these things will, the cost will decrease, or maybe it will also reach your margin, okay, because patients will come more often, and you only need to buy them once, you don't have to buy them again and again. So that makes the cost all reduce over time. So another challenge is the accuracy of the POC. Which kind of POC machine do you want to buy? Which brand is it? Is it the Roche, or is it the other Siemens? Or sometimes these are things that the pharmacists might feel challenged with. The calibration, okay, this is important. Of course, each machine comes with a calibrator and control, but it's also very important if you have a large group of patients coming to your patient. It depends if you're a doctor. If you do this thing in your clinic as well, if you're using the POC, you need to do a calibration. Also, if possible, you should ask the patient once in a year to get their blood drawn at the hospital, and then you compare it with the POC device that you use. Maybe for 10, the minimum you need is for 30 patients only. And if you see whether they seem to correlate well with your readings, okay, this is really, really important to make sure, especially if you have a large group of patients. So it's good to do this calibration once in a while. Okay, so blood pressure screening. So pharmacists also can do blood screening at their pharmacy or at the university, at the hospital, okay, wherever you are. So this is also something I want to share. This is the usual thing that we use. I'm not promoting Emron, okay, but this is what there was photo available in the internet. Okay, so you can use this kind of electronic devices to do the BP monitoring, or you have this machine also which collect, we can store this up. It may be a bit costly, but this machine, it uses patient's data. It can weigh, it can also measure the blood pressure. It can also calculate BMI and also do blood glucose monitoring. Okay, so this is something ideal that you can keep in your pharmacy or in the GP for easy patient access and monitoring. Okay, lastly, after you do all these things, the pharmacist can also do risk scoring. Okay, you can actually score the risk for your patient so they roughly know what is their risk factors. So actually we have a few cardiovascular risk assessment score. So I'm just talking to you about the 4 common ones that they usually use, which is the most common one is the Framingham risk score, which is also known as FRS. So this score is for patients in the elderly, 50 years and above. Okay, what it does, it calculates 10 years risk for cardiovascular diseases. Okay, then the second one is called the SCORE, Systemic Coronary Risk Evaluation. So this one is preferred in the by the European Society of Cardiology. And of course, because it's preferred in the European Society of Cardiology, as you can guess, it is actually, this score was validated in the European countries. Okay. The next score is the American College of Cardiology or American Heart Association Atherosclerotic Cardiovascular Disease Risk Estimator. Okay, this is a little bit very tedious calculator, but nevertheless, it can also be used. It is for patients age. It was actually validated in patients aged 20 to 79 years of age. Okay, the last one is the Q risk. This is recommended by the NICE. NICE is the National Institute of Healthcare Excellence, which is actually located in England. Okay, so this is for UK. So usually it's for that. So for Asia, I don't think there is a cardiovascular risk assessment score, but I think they should come up with one, because I think our cardiovascular risk is a bit different from the Westerners. Okay, but nevertheless, we may have to just use this scores to evaluate for our patients. So, internationally, people in community, they have screened patients. For example, this study done by Liu, she and a team at the community pharmacists held a health screening for plumbers and electricians. Okay, so we expect the plumber and electrician to be quite tough and active people. They're always on the move, doing hard job. So they use the Framingham scoring to calculate the 10-year cardiovascular risk. So the average screening time they took per patient was around 35 minutes. And they found that 47.3% of them at least had a risk score of 10% or more. So this is quite surprising, okay, because you expect this group of patients to be quite healthy, but nevertheless they have quite high percentage of them are actually high risk. Okay, so besides screening and risk scoring, pharmacists can also give a lot of health promotion to the public. Okay, so if you see, health promotion is something that all pharmacists can do wherever you are, whether you are in the hospital, whether you are in the private hospital, whether you are in the community, you can all do health promotion. So health promotion is providing, what is health promotion? It's actually providing service that improve the health of individuals and communities and empowering people to increase control over their health. So we want to educate patients. Now at this age, people can always Google a lot of things. Any lay person, they all know how to Google, and a lot of messages come through their WhatsApp. So we as the healthcare profession, being either doctor or the pharmacist, we can always do health promotion, to provide surveys to improve their knowledge, to make sure that they get the correct knowledge about their health issues. Okay. So one of the things that everybody can do is one of smoking. Smoking is actually like one of the modifier risk factors that we talked about just now. So the risk about smoking doubles the risk of morbidity and mortality from ischemic heart disease compared to the lifetime of not smoking. Okay, so if you're a smoker, it can actually double the risk of morbidity. Morbidity means the risk of getting a disease, okay, and being hospitalized and stuff like that. That's morbidity. Mortality means death. Okay, ischemic heart disease means it's cardiovascular disease, it means heart attack or stroke or heart failure. Okay, so it can double the risk. So when I talk about smoking, it not necessarily just be only for smokers, but also for passive smokers. It is already studied for both group of patients. The risk is actually related to the duration and the amount of smoking. So the more they smoke, the more the risk. So the more longer they've been smoking, if they've been smoking for 10 years, so the risk for them is very much higher compared to a person who smoked recently. So, in Malaysia, they have this Caring Pharmacy. They actually promote quit smoking programs. Okay, the pharmacists there can actually help you quit smoking by providing a customized and personalized smoking cessation plan. Okay, so they actually have the nicotine replacement therapy, such as the nicotine gum or nicotine patch will be suggested and dispensed by the pharmacist. Okay, other than that, they also can provide proper motivation and advice to increase the rate of successful quitting. So many of the pharmacies, they actually have gone through some program to be able to do quit smoking at the pharmacy. This has been done in clinic kesihatan in the government setting, as well as the hospital in the government setting. And that it's also done in the community pharmacy. Okay, so you can also do it in other places as well. Okay, once you decide to quit smoking, so the patient will be given a full session which will be provided by a pharmacist, and the sessions will be arranged based on the patient's ability. Okay, this is from their website. So Caring Pharmacy does that. So, so you see, pharmacist role is greatly expanded in these areas. Okay. So there are other healthcare promotions that they have done, like this Pharmacy Outro. They have the Silver Care Family Day, whereby every 18th of the month, they actually have an interactions day, whereby they share health information with the elderly. So the silver is for elderly patients who come into the pharmacy. So they will be having a consultation. They also have a promotion for blood screenings. Okay, so these are some of the ways that pharmacies promote health to the public. Okay, there are also other promotion by, like, this is also by Watson's. They have, in conjunction with the Heart Health Day, they also have they give these promotions for health products. Okay, so this is another point where pharmacies actually involved in a lot of supplements and nutritions for reducing the cholesterol and other health supplements that they can promote. So pharmacies are quite unique in the sense that they can actually work together with the public. Usually public who do not have any health issues, sometimes who just want to be healthy. So these are the group of patients that you can actually tackle in this kind of promotions. And HTM Pharmacy is very famous in Perak. Okay, you have a lot of branches. You can see Gunung Rapat, Bercham, Cemur, Sungai Siput, quite a number of them. And they also give free health screening. Okay, they have a date specified, and the interesting thing, it is free. Nobody gives you free, but they managed to get it free because of collaboration with another drug company, and they can actually give you free screening. So these are all important things that pharmacists can do in their healthcare settings. Okay, so Malaysia is not very backwards in many ways. They are actually very advanced. If you see, this is a survey done by people in Penang. among the population there, they found that the top 5 health promotion activities done by the community pharmacists were weight management. Okay, a few of them find, whoever went to the pharmacy, they find that they have been somehow involved in weight management. They have been involved in diabetes counseling. They have received diabetic counseling. They have also have information and advice on traditional and complementary medicine. They have been given nutrition and physical activity advices and counseling. They also have received asthma counseling. So these are some of the top 5 health promotion done in pharmacies in Penang. So this is a study done in the Klang Valley. This was a cross-sectional survey done, and they found out that the majority of the study respondents perceived that the community pharmacies they visited offered services for measuring health indicators such as blood pressures. So you see, pharmacies have offered these services. They have also screened their blood glucose. Around 79% get that kind of services, and also cholesterol, so which is 72%. The population perceived that pharmacies should provide weight management services in the pharmacy. This is another area where the pharmacies can do, because obesity is one of the risk factors to cardiovascular. So this is also, as you know, our generation more and more are more prone to a sedentary lifestyle because of the nature of work. Many things are done online. Many things are done in the computer. Okay, so we just don't need to walk around as much as possible. And everyone owns a car or at least a motorbike. So this makes people in Malaysia very sedentary, and making sure that they have a good BMI to protect them from cardiovascular event is very, very important. So public perceive pharmacies as capable of providing screening or testing for hypertension, diabetes, and cholesterol, with the majority indicating that they could be likely to use this screening service if provided in various studies. Okay, this has been done in many, many studies, and this is what the public perceive. They feel that pharmacies can provide all these kind of services. So pharmacies have become essential to preventing readmission because they provide education to pharmacists, patients at discharge. This is something that is done in the hospital. So every patient that have a heart attack in the hospital has been given counseling. They are taught what is how to take their preventive medication, or under the tongue GTN medication. They're told what is important of all their statin therapy. They have been told how they can manage the side effect of all their medications. So this is done upon discharge in all the government hospitals for patients who just suffer a heart attack. Okay, they can also help them from returning to the hospital and out of the clinic. So this is because usually the doctors, they manage their heart attack, and when they are discharged, the last person to see them is the pharmacist, and many times the patient have to rely on the pharmacist to give them certain information, especially on their drugs and their follow-ups and stuff like that. So pharmacists sometimes will help them from in this way. So pharmacy is also the link when other providers don't talk to each other. So this is sometimes when the pharmacist is also the link. Okay, sometimes they have done the discharges, so we are the last person to give the medication. So in many ways, we tell them what to do, where to go from now on, where to see the doctors and stuff like that. Besides the nurses, okay, we are also there to help them in this kind of thing. As healthcare continues its massive overhaul. Okay, so you know the community healthcare is a massive business, is getting very expensive. So pharmacies build their unique blend skills and they continue to grow. Okay. So if you see a pharmacist intervention, how do pharmacists intervention and provide economic outcome in patients with cardiovascular disease? Okay, pharmacists actually they give patient education. So in the hospital setting, they give a lot of education to patients who already have a heart attack. So we can also do this in the community setting. Okay, give education to patients to prevent a heart attack. Okay, they can do medical management, medication management. Sometimes when they are in the hospital setting, where it's a very busy setting, sometimes they don't get the information enough. They can also go to community pharmacies for their medication management. And then measurement and CV risk. Okay, this is what we have done just now. We can do all kinds of CV risk screenings, for example, lipid, glucose, hypertension, weight, and also smoking cessation. Okay, then finally we collaborate with the different healthcare providers. If we see there's a risk, the patient is at risk or not able to achieve its target, we actually refer them to the doctors or the GPs, whereby they can be followed up closely. Okay, so this one, by this they can reduce the drug-related problem and then reduce hospital risk. They can also improve the CV risk and control heart disease, so they reduce excuse me, mortality risk. And then they can improve patients' satisfaction, quality of life, and knowledge. Excuse me. So all this contribute to the reduced healthcare and the well-being of the patient. So with that, I conclude that pharmacists are ideally placed to support existing screening methods by signposting customers of high risk, okay, but when they come to the pharmacy to get services. And they are also the link between the medical practitioners. So you can be a link between the doctors. You can talk to them. If they have an issue with their medication, you can also be the link to talk. So with that, I like to say thank you for your kind attention. And if you have any questions, feel free to ask me.
Thank you, Dr. Doris, for the insightful talk about heart health in the hands of cardiology pharmacists. It is certainly enlightening for us pharmacy students as it is for the public.
Before we end this session, we will be opening the floor to questions for Dr. Doris from the audience. Please drop your questions down in the chat below, or feel free to turn on your mic to ask the following questions. I will be monitoring the questions.
Oh my God. Yeah, I'm gonna.
All right. The first question is, hi doctor, may I know if for someone with hypertension, can they treat it without any medications like eating healthily or exercising?
Okay, thank you for that question. Actually, depends on the amount of blood pressure. Okay, if it is very high, they have stage 1, stage 2, and stage 3. So if you have a very high cholesterol level, blood pressure for over a period of time, then they, based on your level, the doctor will start you on a medication. Okay, but if they think if it's just borderline hypertension, then you probably can start on healthy lifestyle, exercising, and then but definitely you need a follow up with the doctor. And when the doctor decides that with this lifestyle changes, your blood pressure is reduced, then it's fine. But it all depends on what is your blood pressure reading to decide whether you need to start on medication or not. Okay. Shall I read the second question? What is the most?
Thank you, doctor. The second question is from Dinesh, and his question is, what are the more common types of therapy for cardiovascular diseases?
Okay, for cardiovascular disease, if you already have a heart attack, okay, or any coronary vascular diseases, then you really have to start them on a statin. Statin is a drug that you use to reduce your cholesterol level. Okay, this is for secondary prevention. So then you will have to start them on an ACE inhibitor, and you will start them on a beta blocker. These two drugs are also called they are also antihypertensive drug, but they are for cardiovascular, they used to prevent a second heart attack. Okay, another one they have to be on is antiplatelet. Okay, they have to be on aspirin. So these are the drugs that you have, basic drugs that you need to start once a patient have cardiovascular event. That's all. Thank you.
Okay, thank you, Doctor. The next question is from Esther in YouTube. So she has asked, would you advise to do a yearly medical check or for every 6 months?
Oh, okay. So actually, that it may not be necessary. If you're 40 years and above, so you need to get an annual checkup. That is what is recommended based on your age. But if you need to do, if that's when you don't have any risk factors, you start checking annually at 40 years and above. But if you have risk factors, then that will depend on your doctor and how often he needs to get it checked. So you don't have to get a 6 monthly. That's more for your dentist. You might need 6 monthly. But for health, you just need it after you are more than 40 years annual checkup.
Thank you, Doctor. We also have another question here. It is from Hui Moon, and she has asked, hi, Doctor, are there any restrictions for pharmacists compared to doctors when treating heart disease, like in case of diagnosis and prescribing medications?
Okay, in the pharmacies are not advised, are not licensed to treat heart disease. Okay, they are not. They are also not there to diagnose or prescribe medication. These are all drugs that we cannot sell over the counter unless there's a prescription. So what we are doing is actually screening the patient. Screening means giving, testing them like a health check, okay, and find out whether they have any risk factors for heart disease. Once we screen, we have to refer them to the doctor. Okay, that's the only thing that the pharmacist can do. Okay, and we cannot prescribe any medication for heart disease. It's all prescription only medication, so we cannot prescribe. Diagnosis is definitely a work of a medical doctor. Okay, I hope that's clear.
Okay, thank you, Doctor. Are there any more questions from the floor? All right, seems like there are no more questions.
So a big thank you to Dr. Doris for sharing her expertise on the roles of cardiology pharmacists in heart health. It was truly amazing in many ways. On that note, I think it's time to wrap up our talk. We're so grateful for all your support from participants to professionals for lending your years and your time to make this online talk a success.
All right, we are now going to send a quiz in the chat box for you to test out on your knowledge on this. Please take note that prize will be given to the true scorers.
I think you can continue.
All right, thank you very much. And once again, I'd like to remind everyone to participate in the slogan design competition. The deadline for submission is 9 p.m. tonight. Be sure to make your slogan as creative as possible. We will have special prizes for the top 3 winners.
Make sure to follow us on Instagram at QIUPHC_2022 and Facebook at Public Health Campaign 2022 for more updates and to check out our merchandise. A reminder to all participants to please fill up the Google Form link for attendance to claim your CCA hours and CPD points. And not to forget 2 lucky draw entries to be awarded to all participants for our closing ceremony. So make sure you fill up the form.
We'll return at 8 p.m. for our 3rd healthy eating experience featuring a legendary Malaysian delicacy. You will not want to miss this out. We cannot wait to see you again at 8 p.m.
As always, a big thank you to HDM Pharmacy Saw Medical Clinic, and Paw and Sons Bespoke Tailoring for sponsoring this event. This event will never be the same without your help. This is your MC signing out.